Over many years, I have asked patients that I see in this clinic the same question, and generally the answer is the same. The question is, what did you expect to get from a pain specialist? What did you expect to get from this consultation? And generally, the answer is the same. I don't know, or I expected to get opioids. Then I pose that question to healthcare professionals. What do you think a pain specialist does? Well, you're there as a last resort when everything else has been done and nothing works. And you're there to treat patients that have depression and anxiety. And of course, some have said you're there to prescribe opioids. That is not the case. So what I'd like to do is I'd like to share with you what a pain specialist actually does. And I hope that this allows you to understand what to expect should you need to see a pain specialist, should you need to visit a pain clinic, and hopefully know what questions to ask of your pain specialist. So that's what a pain specialist actually does. And effectively that picture there with somebody walking is, I want a pain specialist in a pain clinic to be there from early on, from the beginning of the pain journey, not years down the line when the sensitization has set in, when the fitness has been lost, when the weakness has set in, and when the stiffness is there. We need to be involved earlier on. We need to be involved right at the beginning if possible, because that is when we can make the most difference. Pain specialists address a huge range of specific pain conditions, which I'll share with you after this slide. And we use comprehensive, we use tailored strategies. We do focus on pain reduction, but we also focus on function and quality of life. And we organize and manage other teams around the patient, because there is no one single person that is going to fix pain. There is no one single person that is going to just snap their fingers and make this all go away. And if you see that or hear that online, I don't believe that's true. Pain management is a journey. So one of the big four things that we do is we treat specific pain conditions. And there are the three types of pain conditions. We treat neuropathic pain, nerve pain. We treat nociceptive pain, and we treat nociplastic pain. So neuropathic pain, there are many conditions that cause neuropathic pain, that are neuropathic pain in origin. And I'll just direct you to the slide in front of you. If you have one of these conditions, tell us about it, ask questions. Nociceptive pain is a different type of pain, and there are some nociceptive pain conditions as well. Joint pain, inflammation, spinal pain, osteoarthritis. And nociplastic pain is a bit of between both. It's a bit neuropathic, it's a bit nociceptive, and it's effectively the people with more widespread pain conditions. But just have a look at the neuropathic pain conditions. Chronic pain after surgery, CRPS, neuropathic pain conditions, post-herpetic neuralgia, multiple sclerosis. I saw 2 of each of those patients last week in this practice. Radicular pain, pain down the arms and legs, visceral pain, pain of the organs, pelvic pain, peripheral neuropathy, cancer pain. Cancer pain is a mixed pain condition, should be managed with pain specialist. Number 2, we manage pain medications, and we are good at managing pain medications because that's part of our training, part of our expertise. But we don't just load people up with opioids and send them on their way. If anything, we work hard to help people stabilize medications, possibly even wean medications. Again, there is no one-size answer or treatment fits all. Now, I'm not saying opioids aren't helpful. There are a small group of people where opioids provide function, quality of life in moderately low doses. That's fine. Different discussion. Let's have it at another point. We manage people that are not responding to the usual medications, or getting side effects from some of the pain medications, or are taking a whole bunch of medications, and we need to work out what's right and what's wrong. And of course, if opioids are part of the problem, we can help manage opioids as well. So that's number 2. And then number 3, most of us are anesthetists, but we're all trained in acute pain management anyway, and so we can help in the perioperative period. And I've said this before in other presentations. Surgery can hurt, but it doesn't mean surgery should hurt. With a good plan, a good anesthetist, a good surgeon, everyone talking to each other, sometimes a good pain specialist involved, it is absolutely possible to get people smoothly through sometimes really big and complex operations. So in the surgical field, we might manage people with pre-existing pain. We certainly help a lot of our patients get through upcoming surgery, whether it's related to or not their chronic pain condition. If it's a big surgery, we can help. If there is anxiety and a risk of post-surgical pain, we can help. If opioids are a factor and tolerance is a factor, and there is a possibility that opioids might not work in the post-operative period, we should be involved. And then number 4, we do get involved in people where there are multiple other factors, and that's where the allied health team needs to be involved in their care. And we call those factors the yellow psychosocial factors. That is where thoughts, feelings are a little fixed, a little stuck around pain. And this is something we can dive into in great more detail. If you're interested, please let us know if you're interested in this. Anxiety, depression, catastrophizing, family factors at play, legal factors at play, medico-legal factors at play, fear of moving, and the list goes on. And this is why there is no one-size-fits-all treatment to managing pain. This is why it is so important to have a team. And finally, ask your pain specialists or the people you are seeing that are managing your pain what their qualifications are. Don't be afraid to ask them if they're a fellow of the Faculty of Pain Medicine of Australia New Zealand College of Anaesthetists. That's for Australia. In the UK, it's similar, fellow of the Faculty of Pain Medicine of the Royal College of Anaesthetists. In the USA, it is similar. There are board certified pain specialists. So please ask. Don't be afraid to ask. If you go and see a surgeon, you make sure that they have got the appropriate experience and qualifications. Do the same thing with your pain specialist. Absolutely put them on the spot. It is your body. You're consenting to treatment. You're actively seeking treatment. So make sure you or your family member gets the right treatment.